Okay, ready to take a deep dive into Cuban healthcare. And especially during COVID, this is going to be interesting. We got firsthand accounts, right, from a Cuban medical professional that kind of challenged that picture-perfect image you often hear about. We're going beyond the surface here, folks, uncovering some hard truths.
Yeah, and context is key here. You can't separate the reality of healthcare in Cuba from its political and social structures. Those layers, they're essential to understanding how the system really functions, especially under pressure, like during a pandemic.
Exactly. And our source author, they don't hold back. They lay out all the system's pre-existing issues, even before COVID-19 hit. For instance, you've got this thing called the Global Health Security Index, right? It basically grades countries on how prepared they are for pandemics. Well, in 2019, Cuba ranked surprisingly low, 129th out of 195 countries.
Wow.
And get this, our source author actually experienced this firsthand.
That low ranking, that's a huge red flag. It suggests that even before the pandemic hit, Cuba's healthcare system, it already had significant vulnerabilities, and, well, unfortunately, that's reflected in what our source author experienced on the ground. They describe a system already under immense strain, think chronic shortages of basic medical supplies. We're talking about having to reuse, surgical gloves, even before the pandemic hit.
Seriously.
Yeah.
Reusing gloves even before a pandemic. That's unsettling.
It is.
And what's even more concerning is the author's description of this culture of silence and fear within the Cuban medical community. Can you imagine the pressure of not being able to speak freely about these issues?
And that's exactly why this account is so crucial. It reveals the human cost, the human toll, hidden beneath the surface of a system that discourages dissent. It takes incredible courage to speak out, especially when you face potential backlash for simply telling the truth.
It's eye-opening because the author highlights this massive gap, this discrepancy between the official reports coming out of Cuba and what medical professionals were actually experiencing, particularly regarding COVID-19 cases and even deaths among healthcare workers.
That discrepancy, it really points to a system where projecting a certain image, maintaining a certain narrative, takes precedence, even if that image doesn't reflect the reality on the ground. This control of information is, well, it's incredibly significant.
It makes you wonder, what were they so afraid of the world seeing? Especially when reports from organizations like the WHO, they were highlighting these alarming rates of COVID-19 infections and deaths among healthcare workers globally. But Cuba was strangely absent from those reports.
Right.
It's like they were invisible.
And that omission, it speaks volumes because, as our source author points out, official Cuban reports to these international organizations, they often just excluded data about infections and healthcare workers altogether, which makes you question the accuracy of the information being presented. It raises serious doubts.
This is where it gets even more complicated. Cuba's international medical missions, they're often praised, right? But our source author's account paints a very different picture. They argue that Cuban medical professionals are basically pressured into these missions, facing potential consequences if they refuse.
Yeah.
It's a tough situation.
It's a complicated situation for sure, and the author's perspective, it adds a layer of nuance to how we view these missions. It's one thing to celebrate international collaboration in healthcare, right? That's great. But it's another to consider the possibility of coercion within that system, particularly when it comes to healthcare professionals potentially being pressured into these roles.
This isn't just about the big picture, though. It's about the human impact. We're talking about doctors, nurses on the front lines facing these impossible choices.
Exactly. And the author recounts these heartbreaking stories, about those on the front lines struggling. For example, there's the story of Dr. Yaricel Sariel Estevez, who tragically died by suicide after losing her mother due to what the author describes as inadequate medical care during the pandemic.
God, stories like that are incredibly difficult to hear. It just highlights the immense pressure and emotional toll on those working within the system.
Absolutely. The author describes having to reuse gloves, masks, even gowns due to these chronic shortages. Can you imagine facing that kind of risk every single day of potentially carrying that home to your loved ones?
It's terrifying.
It is.
It makes you think about the trade-offs healthcare workers are forced to make in a system where speaking up can have such serious repercussions.
Right. It's a moral tightrope, And what's even more troubling, that really gets me, is the source author saying Cuba had plenty of warning about the pandemic, but when it actually hit, they were totally caught with their pants down.
Yeah, and they keep bringing up that Global Health Security Index ranking like a broken record almost.
Yeah.
But for good reason, right? I mean, it wasn't like it was a secret. It was a blaring siren that the system had some serious cracks. So what specific weaknesses did that index actually highlight?
Well, it looks at things like a country's ability to prevent, detect, and respond to these kinds of health emergencies, right? Cuba's low score, what it suggests is there are these systemic vulnerabilities from like inadequate infrastructure to honestly just poor resource management. And these weren't just like theoretical shortcomings.
Right, exactly. The author describes this reality of rundown facilities, constant equipment shortages. It's like the system was already on its knees battling dengue outbreaks before COVID even showed up.
It's like trying to sail a ship with holes in the hull, you know? You can try to patch it up, but the underlying structure, it's compromised. The author, they paint this picture of a system where appearances, the image projected outward, it seemed to matter more than actually strengthening the core.
It's heartbreaking, especially for the people on the front lines. They're expected to uphold this image of excellence. Meanwhile, they're grappling with inadequate resources and this stifling fear of speaking out.
Absolutely. And their experiences, it really highlights how crucial independent information is. We need to be able to hold those in power accountable. Because when you're only getting one carefully controlled narrative, it's impossible to really grasp the situation.
Yeah. And it's not just about, like, the pressure to keep up appearances, right?
Yeah.
The author also gets into how this dependence on these medical missions, as a source of income, could actually be harming the quality of care available to ordinary Cubans. What do you think about that?
Oh, it's complicated for sure. On one hand, yeah, medical diplomacy, it can foster goodwill and it does provide essential services in a lot of places. But when you have a system that seems to prioritize profit over, the well-being of its own people, it raises some ethical red flags for sure.
It's like they're sending doctors abroad to earn hard currency while, meanwhile, hospitals back home are struggling to get basic supplies. It just seems deeply unfair both to the Cuban people and the medical professionals who are caught in the middle.
Yeah, and the author describes this frustration, A lot of Cuban medical professionals, they feel like pawns in this global political game. They're torn between this like idealized notion of revolutionary solidarity and the reality of a system that often just treats them as expendable assets.
And it's scary because the author claims the Cuban government actively tried to downplay how severe the pandemic really was,
Yeah.
both to their own people and internationally. Like, they were trying to project this image of strength, this control, while hospitals were overflowing and basic necessities were running out.
Right, and that kind of disconnect between the rhetoric and reality, it can have devastating consequences.
Absolutely. And get this, the author even criticizes international media outlets for, in their words, perpetuating this rosy picture of Cuban healthcare. They argue that journalists were way too quick to accept the official narrative without, actually digging into what was happening on the ground.
Yeah, it's a cautionary tale for sure about the importance of critical thinking. We can't just accept things at face value. We have to question assumptions, especially when it comes to complex systems like healthcare. It's about looking beyond the surface and seeking out multiple perspectives.
And this deep dive really drives that point home. It's easy to get caught up in the abstract, but this is about real people, the doctors, the nurses, the patients. They're all living with the consequences of these systemic issues.
Exactly. It's a powerful reminder that behind every grand narrative, there are individuals with real stories, hopes, and fears. We can't forget about them.
In this account, it really dives into those individual experiences,
Hmm.
especially when you talk about personal protective equipment, the PPE.
I gotta say, I was floored to read that, like, reusing surgical gloves was already common practice in Cuban hospitals, like, even before the pandemic hit. Yeah, it's a pretty stark contrast, right, to that image of a strong and robust healthcare system that we often hear about. It makes you really question the basic level of care if even something as fundamental as infection control was already being compromised.
Totally. And the author describes how those shortages, they became even more desperate during the pandemic. Healthcare workers were being forced to reuse gloves, masks, even gowns. I mean, it's putting themselves at immense risk.
And you got to remember, they were operating within this culture of silence, right? This constant fear of speaking out about these inadequate conditions. So it makes you wonder how widespread these practices really were and what kind of impact did that have on both the healthcare workers and the patients.
It's heartbreaking, honestly, to think about having to make those impossible choices, risking your own health, your own well-being, because the system you're working in is failing to provide even the most basic protections. And the author They don't hold back, do they? They raise some serious concerns about, like, the accuracy of Cuba's official COVID-19 statistics. They straight up argue that the government was intentionally underreporting cases, underreporting deaths, especially among healthcare workers, just to, you know, keep up this facade of control.
Yeah.
It's wild.
It's not just about the lack of resources. It's about this deliberate manipulation of information. It's creating this totally distorted picture of what was actually happening on the ground.
Exactly. And that manipulation, it has these ripple effects, right? Because if you're not accurately tracking the spread of the virus, how can you effectively contain it? And on top of that, you're failing to protect the people on the front lines, the ones who are most at risk.
Exactly.
The author describes this campaign in the early days of the pandemic. That's just really unsettling. The Cuban government was actually encouraging tourists to come visit the island. They were touting it as like this safe haven.
Wow.
It's wild, right?
Yeah. It's a shocking example of, like, putting economic interests ahead of public health, especially knowing what we know now about the actual state of their healthcare system at the time.
It's like they were selling this fantasy to the outside world. Meanwhile, their own people, their own healthcare workers, they were grappling with a completely different reality.
Absolutely. And I think this account really, it just raises so many critical questions about transparency, accountability, and the responsibility that a government has to its own people, especially when you're talking about something as fundamental as healthcare.
It really does. This has been, I'll be honest, it's been a tough deep dive, kind of a sobering one, to be honest with you. But it's an important one, right? We've uncovered some very, very difficult truths about the Cuban healthcare system, especially during COVID-19. It's a reminder, a stark reminder, that behind those glossy images, behind those official narratives, there are real people, real human beings who are grappling with these really, really challenging systemic issues.
Absolutely. And I think it also underscores the importance of critical thinking, questioning what we hear, seeking out those multiple perspectives, and never being afraid to challenge those in power. We have to make sure that healthcare systems are truly serving the people they're meant to protect.
Couldn't have said it better myself. This deep dive has definitely given me a lot to think about, and I'm sure it's the same for you listening. What can we learn from experiences like these? How can we be better advocates for transparency and accountability in healthcare? And not just in Cuba, but everywhere. Those are the questions we need to be asking ourselves.